As a medical professional, you have the ability to live and work in many places, from large urban centers to small rural communities. In many cases, after living and working amid the crowds, traffic, commuting, and stress of urban areas, many professionals tire of this lifestyle and seek a change. The Adirondack region in upstate New York has become an attractive destination for healthcare providers looking to expand or maintain the careers and reputations they've built, but with a more manageable lifestyle. While generations opt to remain in this beautiful part of New York State, it has also become a popular relocation area, offering a diverse array of healthcare opportunities in hospitals, community health centers, public health agencies, dental practices, behavioral health programs, and emergency medical systems. Our state-of-the-art facilities provide excellent care from diagnosis to treatment, and our providers quickly become part of a collaborative network which encourages autonomy and growth. It's a precious commodity to be able to do what you love for a living and to work in a place where you love to live. Dentistry has become a field with an ever-increasing need for professionals. Organizations like Interlakes Health and Hudson Headwaters Health Network have the latest technology and equipment to keep employees current and offer patients the best in dental care.
There's some very good dentists in the local community. The trouble is there aren't enough of them, and so it's hard for people to get care. When we came here, they were just happy to have another dentist. Also, the local dentists in the community were happy to meet, made us feel very welcome there. Being a dentist in Rochester, I was just one of a million, of many. But here, I'm one of few, and I have to be careful to be the best one. They expect me to be very good. I mean, they expect more of me here, I think, and I expect more of myself here as well. I'm doing a lot of things that I would have referred otherwise, but the challenge is to live up to people's expectations. Because, you know, if you're the dentist in a small town, you're an important person in the community.
There are excellent behavioral health and counseling programs throughout the region that are always looking for talented individuals to come aboard.
I find that even though the population isn't that big, the resources in the community to help me with my work are excellent. We work closely with other agencies, so a lot of things are better here compared to New York City, where the agencies are much bigger and the resources are more stretched.
In order to enhance the quality of medical care, healthcare practitioners need to participate in continuing education. It's very difficult in the rural area to get time off to be able to go for continuing education. So we have been working to establish online means of doing continuing education. We are going to be developing programs that will have online didactic information coupled with conversations that can occur either online in a website or by video conferencing to allow practitioners to stay where they are in order to learn for the future. Albany Medical College and the Medical Center have also used video conferencing to allow communities in the North Country to have discussions with experts here, which then allows a practitioner in the rural area to be supported so that people don't have to leave that area necessarily to get the same services. We try now to allow our physicians to back up people in the Adirondacks, from especially specialists. We provide neurosurgical services to all of that region, but our main function, I think, is to serve as the resource for education, professional development, and specialty support. The medical center is a trauma center, and we have helicopter resources that will go and bring people from other sites, and this allows the population living in an isolated area to have the same resources that a high-volume urban center would have.
With the increased need for healthcare providers comes the need for dedicated and qualified nurses and public health specialists, not only to provide quality medical services, but also to encourage healthy behaviors through prevention and education.
Public health, it spans a great number of things in the healthcare field. It's a wonderful opportunity to try to impact people's lives before they suffer the ill effects of chronic disease or illness, and try to give them the information and tools they need to make the lifestyle changes that are necessary. We're always trying to move forward, work together, and there's a lot of opportunity, especially here, to work together. We're moving fast into the 21st century. We have satellite phones, we have paging system. All of our nurses are on laptop computers. That's the way they do their documentation. All of the public health staff are online. A lot of our reporting is now done online. So I think we're very much into the 21st century, even in Washington County.
Supportive services are critical in our rural region, and opportunities abound for emergency medical service professionals and pre-hospital care providers.
EMS in this regional healthcare system plays an important role because oftentimes people who are in need of care are too far away from either local small clinics or large hospitals. In a rural area, that ride, that 10-minute ride becomes an hour ride, and that could be the difference between life or death for a chest pain, heart attack patient. So it's very important that we have qualified, educated pre-hospital care providers in the field in rural areas, because it will end up saving lives in the end. There's amazing opportunity in the Adirondacks and in this region in terms of experience you would get as an EMS provider that you wouldn't get anywhere else.
As you can see, the opportunities are readily available, and you can truly make a difference in the communities of the Adirondacks. Pursuing a healthcare career in the Adirondack region may pay off quite literally. The cost of living in the rural communities of upstate New York is considerably lower than that of big cities. Housing options are numerous, whether you're looking for a reasonably priced townhouse or for your dream home on the waterfront. You can find it here, and you're likely to get more house for your money as well. By living closer to where you work, long, often frustrating commutes can be a thing of the past. In much of the Adirondack region, you can get to work within a few minutes. Another incentive is the possibility of qualifying for student loan repayment programs. In some cases, physicians, dentists, psychologists, and other medical professionals can apply for repayment of their student loans for working in a rural area like the Adirondacks.
We make a good living. There's a lot of rewards that go beyond that paycheck. There's also opportunities for, depending on where you work, to get loan forgiveness or to work out other arrangements that can help with those bills. There's opportunities for career advancement. I started as a public health nurse in the field and then was promoted to supervisor and then worked my way into public health, which is truly what I love. So there's a lot of career advancement opportunities. There's educational opportunities. So there's a lot of opportunity to grow and develop and learn new things.
Competitive salaries, student loan repayment options, job security, and a lower cost of living are all attractive benefits for healthcare professionals in our region. The Adirondack region of upstate New York is a popular tourist destination. Each season brings new visitors to explore what the area has to offer. Residents get the opportunity to enjoy these same attractions from their own backyards. Spring is the beginning of hiking season and a great time to go for a ride along miles of bike trails. Summer brings a variety of water activities in aerial lakes and rivers, and golf at one of our many courses, which Golf Digest has designated the second best location for golf in the country. The burst of color is a sure sign of autumn and an opportunity for apple picking and balloon festivals. As snow blankets our mountains, residents bundle up to enjoy skiing, snowmobiling, and many winter activities. Cultural offerings are vast, with dozens of opportunities to immerse oneself in the arts. And history is alive and well through events dating back to the French and Indian War and waiting to be experienced at many historic sites.
There is no more beautiful a place than the Adirondacks. The Adirondacks has more variety than probably any other rural area in the country. I think it's an area that's undervalued. Having traveled a lot within the Adirondacks, I think it's also interesting that although towns are sometimes 5 to 10 miles apart, sociologically, geographically, each one is very different. And that variety adds a new layer of enjoyment and excitement to people when they come to the Adirondacks.
The communities of upstate New York offer families a safe and simpler lifestyle. The pace of life is less hectic, and the small town charm is sincere. An ideal place to raise a family, the public schools are among the best in the state.
We were a little worried about education. We found the school to be excellent. The class size is very small. It gets a lot of attention. Small communities really love their schools. He plays in the band, he's active in sports, and he just gets a lot of attention that he wouldn't get in a bigger community.
In a small town, a lot of the activities is family-based, so you tend to have things going on. Especially true of the summer months and partially true of the winter months. There's never a shortage of things to do. The outdoors is beautiful, air is clean, the mountains are green, and it's a truly wonderful place to raise a family.
You only have to drive to our centers to understand what a magnificent setting we have. I mean, probably our best recruiting strategy include the quality of life that everyone has the opportunity to enjoy here. And based on this being such an attractive area, if one can create an attractive professional setting, which we've tried to do, that in turn leads to the kind of group we want to be, and in turn is an appeal to others to come to our communities. We have amazing practitioners who could go to so many other communities and earn more money or be recognized as leaders in their professions, and have chosen to come to this community and bond together as Hudson Headwaters Health Network.
When you come here, you will be met and greeted in a modern 21st century facility, virtually unparalleled in northeastern New York. And yet there's that sensitivity that you can only find in a smaller community, a hometown community. So the building says to us, really is big city medicine hometown care. We're blessed in this organization to have a medical staff and 2,700 folks working at this hospital that are unique and extraordinary, just like our service area is. Unique and extraordinary in their dedication, their skills, their talents, and their commitment to continue to grow, to continue to improve. We look for people that have that energy and that commitment, that fervor. When we hire folks, I'm very proud of the people that work here.
Whether relocating or just starting your career, you will find few places more enjoyable and genuine than the Adirondack region of upstate New York. The many opportunities available assure job security and a chance to practice in your field right away. You can quickly become an integral part of the healthcare community. It's a precious commodity to be able to do what you love for a living and work in a place where you love to live.